following is a project of our nonprofit newsroom. Support Midcoast Morning and local community-centered journalism today by signing up to be a monthly sustaining donor at chuy.ca/donate. It doesn't take much money to support local news.
Hello and welcome to Midcoast Morning. Filling in for Joe Pugh one last time, I'm Jack Corfield. Today we'll speak to Donna Hais, the chair of the Fair Care Alliance, an advocacy group focused on the inadequate access of healthcare in the regions of Vancouver Island north of the Malahat. Then, after the break, we'll talk to MLA Sheila Malcolmson about what's being done to address the issue. For now, please welcome Donna Hais, who joins us from her office via Zoom. Please excuse the occasional phone noises in her background audio.
My name is Donna Hais, and I am the chair of the community advocacy group known as the Fair Care Alliance.
And so the Fair Care Alliance was formed to advocate for comprehensive and appropriate care for regions north of the Malahat. What is the state of the situation at this time?
So currently, Central and North Vancouver Island are serviced by a tertiary hospital, which is Nanaimo Regional General Hospital. And we service 460,000 people, which are in our catchment area. And currently, south of the Malahat, there's 430,000 people. We only have 346 hospital beds to take care of those that live north of the Malahat. They have 844 south of the Malahat. And we are grossly lacking in infrastructure. We need our hospital towers from 1962. We don't have a cath lab. As a matter of fact, we're the largest population in Canada that live below the standard of care in terms of heart health. And so Fair Care has come together to really create that awareness within our community so that during this provincial election, we can vote and make it very clear to our provincial government that healthcare is a priority here.
And speaking of the upcoming election in October, what do people need to know about the sort of political aspects of what's going on here with this particular project?
We are slowly getting more infrastructure. I want to acknowledge that up front, that there has been a cancer center announced here. We have had, our ICU has been rebuilt in the last few years, and those are great things, but they are not nearly what we need. And so we need an announcement that encompasses and addresses our full need, just as you've seen in Surrey. Surrey got an announcement for a whole new hospital, tower, cath lab, all of it. We need an announcement for all of that infrastructure to come to central Vancouver Island. And I would encourage those, our constituents, to vote for the government that is promising that type of infrastructure.
Which parties do you see prioritizing this kind of infrastructure?
Well, we've been talking to all of the various parties. So far, we don't have a formal commitment from any of them. All parties have shown an interest in the conversation. So we are waiting to hear back from them at this point.
And how was it that this issue first initiated the creation of the Fair Care Alliance?
Well, that's a little bit longer story. For the past 5 years, I've been the community liaison for MSA, or the Medical Staff Association. So those are the doctors who work inside of the hospital. And so they had been trying for many, many years prior to me coming on board 5 years ago to create awareness in the community about the lack of infrastructure that we have. 2010, Island Health actually did a full infrastructure report on an NRGH. It's 386 pages long. That showed the gross inadequacies that already existed there. But 5 years ago, MSA came to myself and realized they really needed a community liaison, someone to speak outside of the medical community to the community at large to acknowledge what was going on. So we started about 5 years ago having conversations. We did presentations to many community organizations, and we're surprised to see that the general public didn't really have a knowledge of what was happening with respect to access to their healthcare. And we realized about a year and a half ago that there were a lot of groups having a similar conversation. And we pulled together to form what we're calling a healthcare ecosystem. And the healthcare ecosystem has many members. City of Nanaimo sits there. Nanaimo First Nations sits at the table. The First Nations Health Authority, the university, the school district, the family division, the group that's responsible for recruiting and bringing forward retaining of family practice doctors. So that group's really grown really strongly. And we're all speaking the same language. We're all talking about the infrastructure that's needed for our tertiary hospital to actually be successful and service the patients that live north of the Malahat. And from that became the awareness as we move into a political year or an election. that those groups in and of themselves, their mandates are not to basically get into a political conversation, and that really, that conversation belongs with our community. Our community needs to say what they need. They need to give some direction to our politicians at the provincial level. And so that's where Fair Care evolved from. We went out into the community to our various community leader friends and very quickly formed the Fair Care Alliance. I'm really excited about it. We've got a really strong team. From there, volunteers came forward, and volunteers have been manning events and getting out and sharing the information. It's just kind of grown from wildfire from that. And it's really become this community effort where everyone has come together to have this conversation. So it's really exciting to see the community come together to create this awareness.
How does that representation expand beyond Nanaimo for people in the overall north of Malahat region?
There are MSAs at every hospital north of the Malahat. And I think it's important to recognize the work those hospitals are doing. They're community hospitals. The new hospital going in Duncan, that's a community hospital. The West Coast General Community Hospital, Campbell River Courtney Community Hospitals. Those are foundational hospitals that feed into a tertiary center. So for instance, there are MSAs at each of those hospitals that are aware of what we're doing through MSA's work. There are hospital foundations up and down the island that are informed through hospital foundations. We've done other presentations, City of Parksville, Town of Ladysmith, great examples, all signing on, coming together. The city of Nanaimo put a motion on the table to support the conversation around tertiary infrastructure in Nanaimo. They took that to UBCM with the other municipalities on Vancouver Island to inform them and engage them. So through our healthcare ecosystem, we've been able to engage all of our community partners north of the Malahat, and we've been doing other presentations. Our Chamber of Commerce have been huge supporters in Nanaimo. We're doing presentations at other chambers of commerce throughout the island. So that's how we've been engaging with those groups, as well as our media with partners such as yourself and your station, getting the word out to those that live abroad, to the general community who might not belong to an organized group. They're hearing us through our other media pieces. And many of them are getting in touch with us through our website.
What kind of healthcare access can be improved in those more distant communities where they're not going to be able to get a cath lab and they're not going to be able to get access to a huge number of beds, and they're going to still have to travel all the way to Nanaimo?
Yeah. So what actually happens at those hospitals, being community hospitals, is if I break my arm or I need my appendix out, they're my go-to place. So if I'm in Campbell River and I break my arm, I'm going to that hospital. Those surgeons are helping me. That's fantastic. They're doing a great job. But if I have a heart attack and I'm in Campbell River, you're going to get on a helicopter that's going to bring you to Nanaimo. And right now, Nanaimo can't help you because we don't have a cath lab, which means the helicopter may stop here for further diagnosis for you here, and then our guys are going to send you to Victoria, or it's going to go directly to Victoria. So there's still going to be some of that distance, but tertiary programs tend to all group at one location because tertiary patients are complex patients that need multi-levels of care. And right now, the only tertiary program we have out of Nanaimo is our kidney program, which is our lead for kidney or nephrology is actually based out of Nanaimo. But that's why we are petitioning the government so hard to get the cath lab here in Nanaimo as kind of our next step, with the tower following quickly behind, because we need to be taking care of those heart and stroke patients on the rest of Vancouver Island, because right now we can't.
Of the other healthcare issues facing Nanaimo beyond heart and stroke, which do you feel are most pressing, and what can be done to affect change in those areas?
Healthcare is complicated and it's layered. And so once you start delving into the conversation around heart health, then we need to talk about neurology for stroke patients. There's issues right now with our GI programs and not having enough access. Like, the list of all the programs under tertiary need to be addressed. You know, I don't want to diminish the conversation around the lack of family doctors. That's a huge issue as well, that actually our group and the family division sits at our ecosystem table, and that we are actively working on creating programs on recruitment and how we can make Central Vancouver Island the destination for those that are coming out of school or who are immigrating here in healthcare. Like I said, healthcare is an incredibly complicated and layered conversation. And when you start to at least address one area of concern, you start to alleviate some of those other issues as well. So I can tell you there are other studies and other locations that have shown that once you start addressing this issue around cardiology, you start to alleviate some of those other strains on the system. So once you can put a fulsome cardiac program into place, which is more than just building the cath lab, right? We need to build up. We only have 2 cardiologists in Nanaimo. There are 22 in Victoria. So to build the program, not only do we need the cath lab, we need the cardiologists. We also need the beds in the HAU to be critical cardiac care beds. It's a layered conversation that requires more than just we put the building there and that will solve the issue, but it's a big part of solving the issue.
If people listening to this want to get involved with working towards solutions to these problems, what can they do and how can they get involved?
So we would ask you to go to our website at weneedhealthcare.ca. There are opportunities there to connect if you want to volunteer. There are opportunities for people to share their stories there, and there are opportunities to see more of the statistics. But if you go to the website, and we would ask everyone to please sign our petition that's online to let our provincial government know that this is a priority of the community that lives north of the Malahat. And we would welcome anyone who wants to join our team and join their voices with ours. It's been fantastic to see how the media and yourselves have come forward to partner with us and share our story. And I want to thank you for that, because really at the end of the day, this is a community conversation, and it's going to take a community putting all of their voices together to get the attention of our province to invest our province's money where it needs to be, and that's into our healthcare system here in central North Vancouver Island.
Thanks again, Donna Hais, for the interview.
Thank you so much.
Midcoast Morning is made possible by the Community Radio Fund of Canada's Radio Meters program and listeners like you. Support Midcoast Morning and CHOI's nonprofit newsroom today by becoming a sustaining donor at choi.ca/donate. Local news can't survive without your support. If you're listening to the podcast edition of Midcoast Morning, go and give us a positive review on Apple Podcasts or whatever podcast feed you use. It helps people find us.
We just spoke to Donna Hais, chair of the Fair Care Alliance, an organization advocating for increased hospital infrastructure for regions of Vancouver Island north of the Malahat. This area includes 53% of Vancouver Island's population, but has access to only one tertiary care hospital, NRGH. Meanwhile, south of the Malahat, there are 2 major hospitals, each of which host a catheterization lab, a heart and stroke emergency treatment facility, which Nanaimo's hospital lacks. In this half of the show, we'll turn our attention to the medical access shortage in Nanaimo and what's being done to solve it. Please welcome the Honourable Sheila Malcolmson, Minister of Social Development and Poverty Reduction in Nanaimo.
I'm Sheila Malcolmson. I am Nanaimo's member of the legislature and also really honored to serve in David Eby's cabinet. I'm glad to be talking about local healthcare here.
Awesome. Thanks for coming. So Nanaimo is experiencing both rapid population growth and a shortage of access to doctors and nurse practitioners. What kind of action is being taken to alleviate this problem?
We have been working really hard both to hear people on the ground, people contacting my office or when I'm out in community, to make sure that we can connect them with the healthcare that they need and deserve. It's fundamental to New Democrats. Our public healthcare system is the foundation of so much of our work and so much of society. From the beginning, 2017, when we first took government, worked really hard to be able to make up a lot of lost ground, significant cuts in service and, the largest mass layoff in Canadian history was of healthcare workers in British Columbia under the previous government. So a lot of work that we've been doing to make up for lost ground. In Nanaimo, that included opening up the first urgent primary care center here at Medical Arts. It's seen 20,000 patients a year. And a nurse practitioner clinic, the Nexus Clinic in South Nanaimo, opened that up. Again, that was funded by the BC government. That was the first one in British Columbia. And that was a lot of work that Adrian Dix did to remove the barriers that had been in place under the previous government to nurse practitioners being able to do full scope of practice. So we know actions like that for people's primary health care have made a difference on the ground and more to do, no question. And then also making significant investments in the hospital, which started before the pandemic, thank goodness. It was a 2013 study that had said that Nanaimo's intensive care unit was the most dangerous in the entire country. Previous government didn't act on that. It was a major focus of my 2019 by-election campaign. when I moved from being member of parliament for federally for Nanaimo and moved into Leonard Krog's old role as member of the legislature was a major theme in that 2019 by-election. And I think that the people in Nanaimo gave a mandate to the NDP to be able to carry on governing, in a large part based on that example of what happens when you don't invest. And then we've been able to open up state-of-the-art intensive care unit, just as an example of what we can do when we work together and when people push hard.
And you say it was the most dangerous urgent care unit in, was it in Canada or was it in BC?
In Canada, that's right. And that was a study in 2013 that just sat on the BC Liberals' desk that didn't act on it. We did.
I see. What kind of actions was taken in that particular moment, and how are those carrying forward to now?
Well, in that case, the new intensive care unit is open, and it is. You really have to walk through it. I'm just so honored to have been, taken kind of on a guided tour by the nurses that helped design that intensive care unit. That it is designed in every way for the benefit of the patient, but also for the workers. There are lifts, for example, in every room. So we're not going to have our healthcare attendants and RNs injured by doing heavy lifts. The beds are designed in a way that the entire circle of care, all the people on the healthcare team can surround the patient instead of being jammed up into a corner. It was, a real breakthrough and a sign of what we can do when we work together and push hard. And then following that, we, through COVID, stood up a high acuity unit, which is kind of the in-between intensive care and regular care. And that unit is being built and will be open later this year. Another way that when people are in medical crisis, we can serve them much better than what was in place at the old hospital. And then, of course, at the same time, we're really investing in primary healthcare so that people don't get to those healthcare crises in the first place.
So funding and perks for general practitioners in remote areas like Salt Spring Island continue to grow as these positions remain unfilled. What else can be done other than sweetening the pot to attract doctors to remote areas of Vancouver Island or to Nanaimo?
I'll speak to Nanaimo because that's my role. We have been tackling the doctor shortage in a number of ways. One was adding in full scope of practice for nurse practitioners. That helped. Earlier this year, we brought in new rules for pharmacists to be able to prescribe, whether it's birth control or antibiotics for a urinary tract infection. That's taking the load off primary healthcare providers, and it's also helping patients get access right away when it's a less complicated prescribing situation. But the real breakthrough came when the Health Minister, Adrian Dix, negotiated with Doctors of BC a new compensation model for family physicians. And already, just in the first 9 months, it brought in 700 new family doctors. So in many cases, these were doctors that maybe had chosen to work in hospitals as a hospitalist, where they didn't have to deal with individual billing and establish, the complications of having a business, hiring a secretary and leasing an office. So a number of people came back to primary care. And it's kind of interesting, like, leading up to the election in October, I've been knocking on doors, and one block in Harewood, I found 3 young people who had all got a new family doctor just within the last couple of weeks. So we know that the new system is working. New compensation model, but also with that attached to it, saying that a doctor has to care for a certain number of patients. And so we've got kind of strings attached that way. It's making a difference. And I'll also raise my hands to the recruitment efforts that are happening through NRGH, the residency program. When a doctor has finished their class-based school, then they go out and be residents medical students before they become full doctors. And NRGH has got the best record in the province of retaining medical residents. Once people get to Nanaimo, they see what a good community it is. Nanaimo medical community has really worked to retain residents, and things like, we're going to help you connect so that your spouse can get a good job here as well. Ways that help keep people here. So those are all helping. They're all a step up from where we were, but we sure need to do more. And so we're building a new medical school, we've added new medical spots at UBC, and we're also doing a lot of work with foreign credentialed doctors to remove the really mean-spirited and unnecessary barriers that were in place with them. And that's already starting to take effect as well. But we need to do more, and really concerned that we're up against a Conservative government that says they're going to take money out of the healthcare system like they did before. And so we're going to continue to, proclaim the need to elect a government that will deepen investments in healthcare, because we can't go backwards.
And we're seeing development now for this new urgent and primary care center at Country Club Mall. While this may reduce the strain on NRGH and the current center at Port Place Mall in the short term, I still sort of feel like this seems to be a sort of band-aid solution to the more long-term solutions that we're going to need for future projects in the city. What kind of solutions are you, as the city, looking at in the sort of long-term effect of seeing how much Nanaimo is going to grow?
Yeah, well, I would say an urgent primary care center really is, the medical arts is under extreme pressure. And I'm frustrated too when I see that people who want to go to the UPCC, you have to be there at, so early in order to be able to be seen that day. They're just under huge strain. But when an urgent primary care center works well, it does take pressure off the hospital, because people can go for something less complicated. Say their kid's got a high fever. They can go, they can get checked out right away. They could get stabilized. They can also be hooked up immediately with, say, because there's a pharmacist on site, they can get hooked up with a prescription for antibiotics. Or maybe it turns out that the young person is having a panic attack. And so being in a UPCC rather than an emergency room is better for them. But because the urgent primary care centers have got mental health professionals and social workers, that they can, in that case, it's not simply a family doctor. There's a whole team of people there to be able to connect people with the care that they want. So it's much more broad-based. So we really, we want to have as many family doctors as we can in community, but we also recognize that team-based medicine really is the way of the future. And so it's easier for us to train up mental health workers or physiotherapists or pharmacists or social workers to be able to help with people's needs, and then to have, in that case, a trained physician there as the medical overseer. But you won't necessarily see a full doctor on every one of your visits, only if the need arises. So this is a way to meet the pressure of the time that we're at. We wish the previous government had built a new medical school when they had the chance. They didn't. In this term of government, they voted against it when we built it into our budget. So we're very concerned that both the BC Liberals, BC United, BC Conservatives are not in support of taking some of the measures we have to connect more people with family doctors. But in the meantime, we are working hard to get people the healthcare they need, even if they can't connect with a family doctor in the exact moment.
So it sounds like this sort of urgent care and primary care center actually has quite a large, expansive set of things it can do. It's not just like small injuries and a fever. It's a lot of different things that really takes a lot more off the hospital than it sounds like. For many people, their primary care provider will be the urgent primary care center. In other communities that aren't under as much population growth pressure and aging population pressure as Nanaimo is, in many cases, the urgent primary care centers have been the replacement for a family doctor, and that for some people, they really appreciate having that team-based medicine approach so that their needs can be met, kind of a bit of one-stop shopping, as opposed to, say, you go to your family doctor and then he refers you to somewhere else. The urgent primary care center, when it's working to its full capacity, it does provide that one-stop shopping, in addition to, as you say, taking the pressure off the emergency room at NRGH. The Fair Care Alliance has called attention to the imbalance of healthcare access in the North Island region compared to Victoria, noting, for example, the lack of a cath lab at NRGH compared to Victoria's 2 labs. What actions are being taken to rectify that imbalance?
I had such an interesting experience when I was mental health and addictions minister. I got to travel to all kinds of regions of British Columbia, and the disparities in medical service in the north, in particular in the interior, are intense. As a province, we are always working to bring a high standard of care in as many places as we can. The work that we've been doing for Nanaimo, and that's my focus because that's where I represent, we've attracted so far, just since 2017, almost $700 million of investment in Nanaimo, either the hospital or the new cancer clinic that we're building, or the new 300 plus bed long-term care facility that'll actually be built in Lanceville, but it's for our region. So there's never been so much investment in our hospital system, from the intensive care unit to the high acuity unit to the cancer center to simple things like running the MRI machine 24 hours a day and adding a second one so that people can get diagnosis fast. That should have been done in the old government. It wasn't. So we're going to continue to invest in people and invest in the hospital. But at the same time, we really want people to note and remember that while the old government took money out of the system, we've been putting $700 million in. And that's a tell. That's a sign we're going to continue to invest if we have the people's support to continue to do so.
Awesome. Sounds like we have a very optimistic view of the overall healthcare issues in Nanaimo getting better over time. Thank you very much, because that's in part to you. And thank you for this interview, Sheila Malcolmson.
I really appreciate the conversation. Thanks so much.
That was the Honorable Sheila Malcolmson, Minister of Social Development and Poverty Reduction in Nanaimo. Before speaking with the MLA, we spoke with Donna Hais, Chair of the Fair Care Alliance, about the healthcare access issue facing Nanaimo. If you want to get involved with the issue, check out the Fair Care Alliance's website at weneedhealthcare.ca. The Fair Care Alliance is also holding a free event coming up on Thursday, September 12th at the Beban Park Auditorium. Doors open at 5:30 p.m. The rally will include speakers talking about the issues touched on in this episode. That's our show for the day. Thank you for joining me for my last episode as fill-in host and producer of Midcoast Morning. I'm Jack Corfield. Special thanks to our executive producer Jesse Woodward for the opportunity, and to Joe Pugh for taking a break. Our technical advisor is Arby Frew. Thanks also to Dr. Vanessa Swanson, who helped with fact-checking for this episode. You can sign up for CHLY's newsletter at chly.ca/subscribe for updates from our nonprofit newsroom. Our theme song is First One by local Nanaimo band Waste Management. If you have a story you'd like us to cover, email us at news@chly.ca.
Midcoast Morning would not be possible without the funding of the Community Radio Fund of Canada's Radio Meters program and listeners like you. Midcoast Morning is a project of CHLY's nonprofit newsroom. Support nonprofit journalism in Nanaimo and on the Salish Sea today by becoming a monthly sustaining donor at $5 or more per month. Support the program at chly.ca/donate. If you're already a supporter, record a voice memo telling others where you're listening from and why they too should support our work. After you're done, you can email it to us. Finally, this program acknowledges and gives thanks to the Nanaimo First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.